Hello and welcome to the JeffACE Cares Parent Support Group. My name is Allie Barra and I am an occupational therapy doctoral student working with JeffACE. A little bit of who we are, the Jefferson Autism Center of Excellence, or JeffACE, at Thomas Jefferson University. Our mission is to be an international hub of autism activities, and we're dedicated to high impact research, forward thinking education, innovative community outreach, as well as worldwide training and education programs. We serve all autistic individuals across the lifespan. In today's session, we will be talking about occupational therapy and autism across the lifespan. So to start off, what is occupational therapy? Occupational therapy helps individuals participate in occupations that they want to and or need to do through various interventions that help maintain or promote health and well-being for that individual. So what is an occupation? This is considered an everyday activity that people engage in to occupy their time and may be meaningful to them. This may be something that they need to do, want to do, or expect to do. For example, an everyday activity may be getting ready for the day. So this includes getting dressed, brushing your teeth, brushing your hair, eating breakfast. Those are all considered occupations, and those are all things that an occupational therapist can help with. So occupational therapy and autism, what can OTs help with? There's lots of things that they can help with, including sensory processing, social participation, self-care skills, school-based skills, play, daily life skills, and then for older children and adolescents, so teens to young adults, the transition to young adulthood as they begin to get ready to work, live independently, and possibly participate in post-secondary education. So what are some OT interventions that can be used with autistic individuals? Sensory integration and sensory-based interventions are a big part of OT with autism, as well as developmental skill interventions, peer-mediated approaches. So this may be coaching the parent on how to best support their child, modeling, whether it's modeling a behavior or an activity for a child, or modeling a way to support a child for a parent. Visual cueing, so using images, social stories, first then cards to help cue a child, motor development and motor skill intervention, and then also using adaptive equipment and different technology to allow the child to better engage in their environment as well as with other individuals. So where can OT occur? It can really occur anywhere. There's early intervention for the younger kids, typically ages 0 to 3. This can occur in the home. It can also occur in schools. OT can be done in private clinics, day programs, community settings, as well as places of employment. So here we have a quick video that just shows what pediatric occupational therapy is.
What is pediatric occupational therapy? Isn't occupational therapy for adults? You know, since they have occupations? Actually, children do have occupations. They include reaching developmental milestones, play, self-care, things like eating, sleeping, dressing, grooming, and bathing, and academic tasks, handwriting, fine motor skills, focusing attention, and socializing. That's where a pediatric occupational therapist can help, or OT. Occupational therapy is concerned with promoting independence in activities of everyday life or occupations. Pediatric OTs work with babies, very young children, and school-age children in collaboration with the child's family, teachers, and other health professionals. Pediatric OT can benefit children who fall into several categories, from premature infants to kids with ADHD to children struggling to read or write. What areas can pediatric occupational therapy address? Cognitive skills, remembering letters, shapes, and sequences. Fine motor skills, finger dexterity, wrist and forearm control, and hand strength. Gross motor skills, balance and body coordination. Self-care tasks, dressing, bathing, and self-feeding. Social skills, taking turns, listening, and following directions. Emotion regulation, helping kids understand and process emotions. Sensory processing, receiving and responding to information that comes in through the senses. During an initial visit, an OT will evaluate a child's strengths, as well as difficulties, and critical developmental areas, and design interventions that promote the healthy development of skills needed for success with daily activities. Through meaningful activities and play, OT facilitates the development of age-appropriate skills. These foundational skills allow for the development of self-confidence in children to help them play, learn, and grow. When skill and strength cannot be developed or improved, occupational therapy offers creative solutions and alternatives for carrying out daily activities. At Community Stars, we focus on 3 things: the child's strength,
So that was just a quick video that gave us a bit of an overview of pediatric occupational therapy. And then the next few slides will be going into a little bit more depth. So for early childhood, this may be considered ages 0 to 3 and 3 to 5. This is typically when a diagnosis occurs. So an OT can't necessarily diagnose autism, but they can use various screening tools to help determine a possible autism diagnosis, or they can refer families to diagnostic services. During this process, they can support you and your family, as well as address any concerns you may have about your child. And if you're looking for occupational therapy services, but you don't have a diagnosis yet, that's okay. You can go to an occupational therapist and they will determine if your child has a need for OT, even without a specific diagnosis. Typically, early intervention is the first stage of occupational therapy that is completed for a young child. So this is a federally funded program through IDEA, or the Individuals with Disabilities Education Act. And it's for at-risk children, so children who may not have that diagnosis yet, but are at risk for developmental delays, or a child who does have a diagnosis. Typically, it's birth to 3, but in Pennsylvania, it is birth to 5. Early intervention focuses on those everyday activities with the child and their family instead of more skill-based activities that may be the focus for school-based OT. So for the young child, their occupation is mainly play, and these interventions will revolve around the family's routines and activities. Family-centered care is also a large part of early intervention. The parent is considered the expert in their child, and the interventions will include them as well. So just early childhood continued. Typically, it's delivered in what's considered the child's natural environment. So for most kids, this is at home, but early intervention can be done over telehealth now, especially with COVID, or in a clinic or community settings. For example, if you go to the clinic, it may be a time that an OT can work on those transitions from a familiar place like home to a more unfamiliar environment like the clinic. And they can use modeling to show parents how to support their child during this transition. And as that child continues to age, they might begin to transfer into preschool services around age 3 to 4. It really depends on the state, as they may have aged out of early intervention services. And the OT will support you during this transition as you get ready. Their goals may become a little more educationally relevant, so learning those early preschool skills. This is just a list of services in the PA, Delaware, and New Jersey areas. Elwyn has a very comprehensive list of evaluation sites, and it's very detailed, and it can be accessed through this link here. Then there's the Children's Hospital of Pennsylvania, or CHOP. They do tend to have longer wait lists. Havertown Child Guidance Resource Center in Havertown, PA, and the Center for Autism right here in Philadelphia. They are also available for diagnostic services. And then there's St. Christopher's Hospital in Philly, but they also tend to have longer wait lists. Next, we have middle childhood, so ages 5 to 12. This is when you begin to transfer a little bit out of the home and more into your school-based settings, outpatient clinics, community settings, or private practices. The interventions begin to focus more on those social emotional skills, so self-regulation and social skill training, as those kids kind of enter those preteen, middle childhood years and start to develop a lot more social interaction, social emotional, and the interventions tend to focus more on that. Motor impairment and as well as activity participation interventions are often used, and this may make environmental changes, or changes to the activity in order to support participation for the child. In school, an OT can help support a child's sensory processing regulation, social development, and school skills. So, this might be writing, organizing, and planning school materials and projects. An OT will use a strengths-based approach to determine the child's interests and explore the relevant activities. Next, we move on to adolescence and young adulthood. So, this is considered ages 13 to 22. And the settings are pretty similar to that of middle childhood, so school, outpatient clinics, community settings, or private practices. The interventions will also focus on more social emotional skills, self-regulation, and social skill training. There also may be a focus on mental health, as kids these age often go through a lot of turbulent times, as well as in high school can sometimes be hard for autistic individuals. So this helps develop coping skills as well as more self-regulation. There is also tends to be an increase in independence and self-care skills around the home, getting dressed, participating more in helping out at home. So OTs can focus on those self-care skills as well as possible job skills and school-based skills. Now, in most states, transition planning must begin by age 16. However, it is recommended that you start to think about this around age 14. And an OT can help in this process by preparing the individual for their future role as a young adult, whether they're looking at job skills, post-secondary education opportunities, or independent living. The autistic individual is always involved in their transition planning as well as the parent, and the OT will work with them as well as the team to develop appropriate and relevant goals. So the settings are the same. And just a little bit more on interventions. There's that focus on post-secondary educational opportunities. So college, like I mentioned, employment training. So there may be opportunities to go to potential job sites and work on those necessary skills. So social interaction, planning, organization. And then there's also a focus on independent living, ADLs, which is activities of daily living. And those are the things you need to do every day. Like you mentioned, getting dressed, going to the bathroom, brushing your hair, meal prep, eating. And an OT can provide supports for that as well as for housing and residential supports if they're looking to move out into independent living. There's also community-based skills that are important to learn. So this can include travel training. So this might either be using a map to learn to walk around the city and navigate that, or learning to use the train. So, learning to use SEPTA. And like I mentioned, it's important to start early as possible with this transition planning. There is also education on sexuality and intimacy, which we will be talking about in a future support group with a guest speaker. So we do have a video that shows a little bit about occupational therapy and those young adults.
On your marks.
Get set, go!
Go! I'm Kathy Cheek. I'm Will Cheek's mom.
All right.
Will is just 17. You say it. On your marks. Hey.
Get set,
Get it, go. It's about a year ago, all of a sudden, he got this crazy beard. and it was just getting longer and longer and longer. I didn't know how I was ever going to be able to get him to shave.
He's always been very on the hypersensitive end in terms of auditory input, tactile input. Let's try it on the hand first. Ready? 1, 2. Okay. Had to work on desensitizing him to the sound of the razor. Ready? I'm Holly Nelson. I'm an occupational therapist. 4, 5, 6, 7. You can say, help me.
help me.
Okay. So this is therapeutic listening. A lot of children on the spectrum tend to overly perceive auditory information. Therapeutic listening is music that is electronically altered or modified to teach the child to orient to the sound, focus, and then take a break.
There was a tree all in the woods.
It sort of opens the door to the neural connections, which helps him to calm and get organized. The vestibular system a lot of people don't know about is the sense of movement and body position in space. So the swing's giving him vestibular or movement input, feet up, and the sheet gives them some extra deep pressure. So I'm combining all of those together to bombard that central nervous system with calming, organizing sensations. We're gonna do the blue pillow. It's my turn. I want to bounce you. Thank you. Whoa! You need to, again, have organization of the central nervous system, the sensory systems, in order to be able to sit down at a table and try to write and type and to shave. Job. Nice work with cursive H. Good. Up and over. Make a belly and kick it away. Mostly he dislikes the noise and the tactile sensation, but it's primarily the noise, and we can handle this briefly. Let's try it on the hand first. Ready? 1, 2, 3, 4, 5, 6. It started with, we would just touch it to our hand in that position without it even being on. And then we turned it on and touched it to our hand. All right, now on the face. 1, 2, 3, 4, 5, 6, 7, 8. Your turn. Letting him have some control over it helps. And when we started, he was turning it off right away. No, no. And, you know, trying to run away. 1, 2, 3, 4, 5, 6, 7, 8. Your turn. Ready? 1, 2. So now we're at the point where we're actually, with it on, running it down the side of the face several times. Good job. That was awesome, buddy. Mom will come down a few minutes before our sessions end, and I'll either show her what we've just done or explain it to her, and then they will be trying to do that at home also.
So we're gonna shave. Come here. Do you wanna do it by the mirror? Okay, here. All right. Every week we bring the razor to OT with us. Good job. Look over here, and now we got to get under your chinny chin. So he will only let me use the mustache trimmer. But we're working on getting him to use the bigger side of the blade. But at this point, I'll take whatever I can get.
The whole idea is that he'll be independent in these activities of daily living.
I think he's very proud of himself.
Excellent work using the razor. I'm so proud of you. Awesome.
So that video just gives us a little bit of an overview of what occupational therapy can look like when working with adolescents and young adults. Of course, that's only one example of an intervention. There's a lot more OTs can do to support them, and that might not necessarily be what they do to support your child. So moving on for young adulthood to adulthood, the setting for this can really vary depending on the individual. Oftentimes it's paid for by insurance. So for Medicaid, the home and community-based service waivers, the HCBS waivers, they cover at home and community settings to support work and independent living. So an OT can go to an individual's home or work with them in the community to support them. OT can also occur in institutional settings, a clinic or outpatient hospital OT services for these individuals. Interventions for young adult and adult autistic individuals tends to focus more on job skills, independent living skills, post-secondary education skills, community and social participation, as well as self-care skills. And when it comes to post-secondary education, an OT may be more of a consult with the disability office and can help advise on the necessary accommodations for their autistic students. The same can be said for job skills. They may go directly into the job place with the autistic individual, or they can provide a consultation for the job. Another intervention is transportation or travel training, as it was mentioned with adolescents to young adults. So this may be learning to navigate the train or public transportation to go places like taking SEPTA here in Philadelphia. When it comes to aging, the OT may work with the individual's primary care doctor to support everyday activities and ensure the individual can continue to engage in them. And as the individual ages, like any individual, an autistic individual can develop chronic or other medical conditions. And when it comes to this, medication management may be necessary in order to ensure that the correct amount of medication is being taken safely. These are some resources for young adults and adults. This includes the Neurodiversity in the Workplace program, as well as the Neurodiversity Employment Network. We will be having a guest speaker from the Neurodiversity Employment Network in our February group. So this is an opportunity for open discussion or just reflection. So what have been some of the experiences you have had related to accessing therapeutic services that you may want to share? And if there are any other resources that you're aware of and would like to share with the group, please feel free to share through email or comments. And of course, advocating for services is always really important. And you can advocate to obtain OT services for autistic individuals by talking to your doctor about a referral, talking to a school counselor or case manager for an OT evaluation in school, or contacting a rehab center or outpatient therapy center for guidance on how to obtain an OT evaluation. These are just save the dates. So our next session will be on February 21st at 6 p.m. And our guest speaker will be Dr. Kate Rossica, who works with the Neurodiversity Employment Network and is a JeffACE alum. She'll be speaking about opportunities in the Philadelphia and tri-state area for individuals with autism of transition age, as well as the programs they offer. And just another reminder that it's never too early to start reviewing these opportunities. Our March session will be on March 28th at 6 to 7 p.m. and we'll be having speakers from the Philadelphia Parks and Rec, and they'll be discussing opportunities in the community for autistic individuals. We'll also have a special guest speaker who will be presenting on comprehensive sexuality education for autistic youth. These are just some upcoming events in the area. There is a basketball clinic at City Athletics on February 4th. They do need pre-registration. The link will be here. There's a Zoom cooking event on the 7th, 14th, 21st, and 28th, and they send a list of ingredients and recipes beforehand after you register. A new group, Awesome Cuts, is providing free autism-friendly haircuts in Philadelphia on January 27th at 3:30 to 8 p.m., and this will be a recurring monthly event at different locations around the area. Their social media is listed here in case you want to follow them for their future events. And we thank you for listening to our support group presentation. If you listen to this presentation, please make sure to take the survey. You can use the link or the QR code to take the survey and provide any feedback. Thank you.